Hi everybody, I'm Lucy Papia. I'm the Manager of Rehabilitation Services for Kaleida Health, and today we're going to talk about accessing outpatient therapy within the Kaleida Health system. We have two locations and they're called Buffalo Therapy Services, and we are the outpatient therapy provider of Kaleida Health. One of our locations is at the DeGraff Wellness Center and the other is at our Maple West Plaza in Williamsville. Accessing care. It's very important that there's a physician referral for every patient that seeks care at either of our two clinics. Any medical provider can write a referral for therapy services. So you can have an MD, NP, PA, all can write a referral. Many of their patients get their referrals from their primary care provider, their orthopedic specialist, their neurosurgeon or spine specialist, neurologist, or any other of their medical providers. Usually, patients are given their referral after they've been seen in an office visit. The services that we provide are physical therapy, occupational therapy, and speech-language pathology. Many times patients require multiple disciplines and they will see each needed therapy in the same office visit. So if your provider writes you a script for physical therapy, occupational therapy, and speech therapy, you can see all three services within the same office visit. Physical therapy. There are many common conditions that we treat, including orthopedic conditions such as back or neck pain, joint pain or fractures, post-surgical treatment after a joint replacement or any other type of surgery, sprains or strains. We also see people who are struggling with dizziness and need vestibular therapy, someone who has a neurological condition or injury, such as stroke or brain injury, neuromuscular diseases or disorders, such as MS or Parkinson's disease. We do cancer-related rehabilitation as well, such as lymphedema therapy, therapy for any other cancer-related impairments, or somebody who is struggling with falls, weakness, or balance issues. We have a physical therapist that is certified in the Parkinson's Big program at our DeGraff location, which is a specific therapy program geared towards Parkinson's patients. For occupational therapy, there's many common conditions that we also treat, such as neurological conditions or injuries, neuromuscular diseases, disorders, post-concussion syndrome, vision issues or impairments after concussion or brain injury, cancer-related impairments, anybody who's having difficulty with activities of daily living, or hand and wrist injuries. We also have an occupational therapist that is certified in the Parkinson's Big program at our DeGraff location as well. For speech therapy, we treat many common conditions that for patients who have speech and swallowing issues, including due to the following: neurological conditions or injuries, neuromuscular diseases or disorders, post-concussion syndrome, cancer-related impairments, vocal cord dysfunction, cognitive impairments, chronic cough, and many other conditions that can lead to speech, swallowing, or cognitive issues. We also have received a grant for the Parkinson's Speak Out in Loud Crowd program. We have speech therapists that are certified in giving this type of therapy at both of our DeGraff and Maple West locations. Making an appointment and accessing your care. You'll call one of the two locations, and I have the phone numbers here listed below. You'll be scheduled in the first available appointment. We offer very specialized hands-on care that is individualized to meet the unique needs of each patient. We have lymphedema certified therapist, vestibular certified therapist, multiple different Parkinson's related programs, and many more. So I'm going to open it up for questions now. What types of therapy are available for cancer rehab? So like I mentioned, we have multiple lymphedema certified therapists at both of our locations. So if you need your lymphedema care, we can provide it at either of our locations. We also can provide care for patients who are suffering from any cancer-related impairments like weakness or fatigue, chronic pain. Many times people have impairments that are limiting their function due to chemotherapy. We provide all of these different types of therapy for our oncology patients. Do both locations provide the same treatments? Yes, we have all 3 disciplines at both of our locations. So we have PT, OT, and speech therapy at both locations, and the therapists are able to treat the same common conditions or disorders at both of the locations. Do we offer evening hours? We do offer some evening hours. We have a wide array of hours available and appointments available for our patients. We start as early as 7 a.m. at our locations, and we have patients coming in as late as 5:30, or 6 p.m. so that we can accommodate patients who also have to work around their work schedule. Okay. Thank you so much for coming to this Healthy You. I really appreciate you guys listening, and we would be very happy to provide your therapy care at either of our Buffalo Therapy Services locations.